in her left kidney, and I found this in her small intestine, and in her ureters, and in her thyroid, and in her liver, was Botox. And the large intestine, excuse me, was Botox. Botox. Do you know that Botox is made of the botulinum organism? And botulinum destroys nerve tissue. So when they get rid of a wrinkle, they inject this liquid from the botulinum Botox vial. They inject the organism and the toxins of the organism into the nerve. So what it does is it paralyzes the nerve, and now the wrinkle goes away. That's how that works. So I asked her, did you get Botox? Do you get Botox? Oh, yes, I do, of course. She looked with a smile. Of course I do. I said, the Botox is bad for you. It's got botulinum in it, and they're putting the botulinum into your body with that Botox. She says, what do you mean? I said, I found that Botox was damaging your thyroid and damaging your liver and damaging your kidney and damaging, as I mentioned before, the parts of the body that it was in. The ureters, the kidney, is in the small intestine, large intestine. She said, really? And I said, don't get that Botox again. And she said, but I don't want to see my wrinkles. I said, but every time you get that injection, they're giving you the botulinum and it's going into these parts of the body. Do you suffer with complaints of arthritic pain? Are you suffering with pain in your joints and in maybe your limbs and in upper or lower limbs, or muscle pain? Are you also dealing with chronic fatigue? And have you been diagnosed with a thyroid disease, a thyroid condition like Hashimoto's thyroid disease? Have your physicians told you that there's no way to get you better, just try to balance out your thyroid hormones, and that's just your lot in life, and that's what you have to deal with? Maybe you've tried different diets. Maybe you've tried different methods of healing and taking different vitamins and nutrients and colon cleanses and parasite cleanses and various things, and maybe you've gotten a little bit better, or maybe you have not gotten better at all. In this video I'm going to share with you, there's a woman who came to me. I don't actually want to show this clip of her video. She did have incredible recovery. She said she felt years younger. She was so impressed with how she felt. And then all of a sudden the pain starts coming back in, and the fatigue coming back in, and just not feeling right, and very concerned. And actually, and the reason why I'm making this video is because she actually started saying, I don't think these treatments are working, and I've done already 2 treatments with you, Dr. Herman. I was better, and now I'm going backwards. I just don't understand. We've already done 2 treatments. Why did I get better after the first one, and why am I going back after the second one? And between when I saw her in November for her second visit, which was November of 2018, the day she left my clinic after her exam, 2 things she did on that day and one during the next couple of months, because I saw her again in May. So we're talking that you know, there's 6 months difference between the 2 visits, number one, and number 2, that protocol from November that she followed lasted for a period of, I think it was about 2.5 months. So I didn't see her for another 3 months in between, okay? One thing that she did, which I asked her because I found with her in her exam, one thing that she was doing was getting Botox injections to get rid of the wrinkles. And the second thing that she did was that she was getting dental work done, which I diagnosed in her that she had some diseased teeth and she had some infection underneath the crowns, and certain things had to be cleaned out, a tooth had to be pulled. So one thought I had was that she was toxic from the dental work, which I found out to be true. And the second, I had a feeling, I didn't know about the Botox injection yet, I'll tell you how I found it in just a moment. But the second thought was that she was constantly consuming mercury-ridden sea salt, which she believed, because the nutritionist at the store, and reading things online, and just looking at the beautiful, you know, kind of hypnotizing labels on these bottles of these pink Himalayan sea salt, I told her that she shouldn't have the sea salt anymore, that it can be causing her pain because it's ridden with mercury, because there's mercury in parts of the ocean. So when I examined her, I found in May, I found in her that it was the pink sea salt and the lidocaine from the dental work and the septocaine, which is another numbing agent, local anesthetic from the dental work, in her left kidney. I also found in her left kidney, with this very unique bioresonance method that I test with, she had the crown, the cement that they use to put the crown on the tooth, the cement was also caught up in her left kidney, and the antibiotic called amoxicillin was in the left kidney. The next part of the exam I found with her in her left kidney, and I found this in her small intestine, and in her ureters, and in her thyroid, and in her liver, was Botox. And the large intestine, was Botox. Botox. Do you know that Botox is made of the botulinum organism? And botulinum destroys nerve tissue. So when they get rid of a wrinkle, they inject this liquid from the botulinum Botox vial. They inject the organism and the toxins of the organism into the nerve. So what it does is it paralyzes the nerve, and now the wrinkle goes away. That's how that works. So I asked her, did you get Botox? Do you get Botox? Oh, yes, I do, of course. She looked with a smile. Of course I do. I said, the Botox is bad for you. It's got botulinum in it, and they're putting the botulinum into your body with that Botox. She says, what do you mean? I said, I found that Botox was damaging your thyroid and damaging your liver and damaging your kidney and damaging, as I mentioned before, the parts of the body that was in. The ureters, the kidney, is in the small intestine, large intestine. She said, really? And I said, don't get that Botox again. And she said, but I don't want to see my wrinkles. I said, but every time you get that injection, they're giving you the botulinum and it's going into these parts of the body. Listen, if you took a dye, if you opened up this pen, broke it, and just sprinkled dye on me, it's going to spread throughout the shirt. And it will stay there forever. Unless you bleach it, but the shirt will never look the same if you try to bleach it. Right? So the ink spreads through the tissue. If you put a blue dye in a bucket of water and put a white t-shirt in that bucket of water with the blue dye, the dye is going to go throughout the whole shirt. When you get an injection with the Botox, it's going to go through parts of your body because it gets injected into the nervous system, maybe into the muscle, and as well as blood vessels pick up that organism and that liquid that's there of whatever they say it's safe and the FDA approved. It's going to go to different parts of the brain and the body, and it can make those parts of the brain and body not function well. This woman had nearly 100% recovery with me after one round. She goes for the dental work I asked her to go for. I told her there might be some toxic effect from the dental work, even though we have to clean up some infections in there and mercury coming out of the teeth. But she was also getting Botox injections. So it brought her backwards. So it's not that she wasn't getting better. She was getting better, but now we have to address the other parts of her lifestyle because these other factors are big deal, big factors that are causing her body to go backwards and feel horrible and feel joint pain and feel fatigue and just feel sluggish and mentally sluggish and just not feel right. Listen, when you get a dental procedure to remove a mercury filling, they inject you with a numbing agent. Guess what? That numbing agent, that goes into your body just like the dye in the t-shirt I said. It goes through your circulatory system. It can end up in the brain. It can go to your thyroid. It can be in your ear. It can go to your heart. It can go to your liver. It can go to your pancreas. It can go to your intestines and stay there. Kidneys, anywhere. Your bone marrow, it can go anywhere and stay there. Just because they say that you pee it out, how do they know you pee it all out? How do they know? What tests are they? I'd love to see their tests because with this unique method I practice, I'm finding it in people. I am finding it in their tissues, causing damage to the tissue, causing weakness of the tissue, causing fatigue of the tissue. Okay? So it was about the numbing agent. The antibiotic that they gave her also was residues of that still in her tissues, causing her body to not feel perfect. And from the dental cement that they used to put the crown on. You're swallowing little bits of that cement. I found that in people's kidneys. I found it in their brain. I found it in arteries. I found it on the thyroid. I can find it in the stomach, causing symptoms in the body that no other method. You're going to run a blood test. You can run a food sensitivity panel. You can run a stool test. You're not going to see this. You're going to look for infections maybe in the blood or the stool. You're not seeing this. This, we have to have a keener mind to be able to find. And again, I'm getting back to that Botox. Getting that injection, the chemical is going, with the infection is going to different parts of the body and making it sick. So I'll see her again in about 3 months after she completes this protocol. I just have to touch base with you and share this one. You can watch other videos on my YouTube channel here. I put up incredible recovery videos where people are getting better following my work. Yet when there is regression, it's caused by something else. Something is in that person's life and their body that they've taken, they've eaten, or they've been injected with that is causing an exacerbation, causing a regression into those symptoms again. So this is too important to not share. And I look forward to seeing her incredible improvement in the next round. I provided her remedies to get rid of the Botox, to get rid of these dental materials from her body, as well as the salts that are loaded with mercury that are in her tissues that are causing her to not feel well. So subscribe to my YouTube channel, turn on the bell, hit the bell to turn on the notifications to get new videos, emails from YouTube when I put up new videos. You can call my clinic at 954-370-3100. That's 954-370-3100. And you can even email my clinic assistant at office.askdrherman@gmail.com. You can send an email and you can get an appointment here. Unfortunately, insurance companies don't provide coverage for this kind of care. Fortunately, the fees are pretty affordable. And so, but fortunately, you can have my diligence, my brain, my diligence behind working with you and for you with compassion and passion to help you get the job done. It means everything to help people get well in the shortest period of time possible. Everything. That is what it's all about, incredible results. For some people it takes longer to get better, some people it's pretty quick. It just depends on the amount of toxicity and infection that's in various tissues and how fast your body can actually rid them. Okay? I look forward to helping you. Call my clinic. See you soon.